right, we'll go ahead and get started. So welcome everyone. Thank you for joining us today for today's office hours. Just as usual, our meeting guidelines. So if you have any questions, please make sure to submit them in the Q&A form that's in the chat, or you can go ahead and use the raise your hand feature, or you can add it in the chat. We also would like if you guys can sign in, so you can go ahead and use this QR code on the screen, or you can use the link in the chat. I'll give you guys a couple minutes to go ahead and do so. All right. So today we have a couple updates and reminders. So we're going to start off with the CYBHI fee schedule program manual. So this is now available on DHCS's website, but we also have it accessible on LiveFinder. So this program manual is really specific for like the requirements and the processes for eligible practitioners. And so we highly encourage, if you have the chance to look through it, especially if you're part of the participating cohorts, because it does have some great information. And just a reminder from our last office hours, we do have 2 grants that are closing next month, one on October 3rd and the other one on October 4th. So if you have any questions regarding these grants, you can go ahead and reach out to your point of contact and we can provide you with any support and assistance. We would also like to introduce this feedback form that we don't typically do in our office hours, but we wanted to try something new. So we are going to send out a feedback form at the end of our meeting, and then we'll also send it out in an email because we want to hear back from you guys. We want to know how we're doing, but we also want to know what type of topics, resources, and support that you guys need from us. All right, so that's it with our updates and reminders. We're going to jump into upcoming events. So we do have a couple upcoming events this month and next. So we'll start off with our webinar. So our webinar will take place October 1st, and it's going to focus on tackling stigma. And our speaker is from the community. They're part of a private practice. They're a therapist, and they're going to talk about best strategies on tackling stigma when it comes to families and the community and students. So we're going to also add this flyer onto LiveBinder, and you can go ahead and register through there. Our next event is going to take place next week on September 25th in Rancho Cucamonga. So this is the Whole Child Collaborative. We do this quarterly, and this is basically an opportunity for LEAs and community-based organizations to come together to discuss what's happening in the community and then leverage the current work that they're doing. So we highly encourage LEAs to come out here because this is an opportunity for you guys to network and see what community-based organizations have to offer. We also have something very similar happening in the High Desert. So this is the High Desert Mental Health and Wellness Network. And this is happening on October 2nd from 9 to noon. And that is it with our upcoming events. I'm now going to go ahead and pass it over to Addison, who's going to talk about TUPE and how it aligns with the CYBHI fee schedule and all the work that we're doing.
Awesome. Thank you, Marwa, and good afternoon, everybody. Thank you for joining us. So I wanted to, first off, want to say I'm thankful to Veronica, Marwa, Karen, Alex, and Marissa for allowing me the opportunity to come and speak. So my name is Addison Saenz. I am also with the San Bernardino County Superintendent of Schools. We are actually within the same department, the Healthy SUV CSS department. But what we wanted to share with you today was another program opportunity that we have that may help some of you amplify the work that you are doing through CYBHI and the fee schedule. And this is going to be around addressing and preventing substance use within our schools and with our students. So I'm gonna, if you don't mind, Marwa, clicking on the next slide. So as Marwa mentioned, we are part of what's called the Tobacco Use Prevention Education Program. However, don't let the name kind of sway you away from this. That is who funds us. That's the program that we get funded from the state. Really, our goal is to address tobacco, vaping, marijuana, and then also looking at how we can incorporate some of the work that you're doing through mental health and incorporating this stuff into the fee schedule. Now, my goals for this presentation today is really to give you an overview of this prevention program, to give you an idea of what the resources look like, and then also to explore some strategies that can help you address discipline-related violations as it pertains to vaping, cannabis, and tobacco. And then also have an opportunity at the end for you all to have any questions, and then also go over some opportunities that we have for you, because there is going to be an opportunity for you all to, if you're interested or if your district is interested in joining our program for the next 3 years. So we're looking at beginning our application for the 26 through 29 school years. So go ahead, Marwa, if you can click on the next slide. So as I mentioned, our program, it's funded by the California Department of Education. Our funding comes from Propositions 99 and 56, which are the tobacco taxes. And so the tobacco tax funds various different programs across the state. And then one of them being is the tobacco use prevention education program. Now, the thing about that program is it is a competitive program that the California Department of Education does put out. One of the ways that we bring this program to San Bernardino County is that we actually apply as a consortium. So every 3 years, we look for various school districts who are interested in addressing vaping and marijuana use in their schools. And the way we do that is we basically come together. We apply as a consortium currently for the 23 to 26 school years. Are working with about 10 school districts, making up 42 schools. The age groups for this is grades 6 through 12. And so by bringing our schools together, that allows us to be able to expand the amount of funding we get, which allows us to be able to spread more resources equally amongst the schools. And then also really the program also focuses on prevention. The goal of this is those tier one supports that allows us to prevent the usage of these substances, but then also allows us to have and incorporate early intervention and cessation resources for those that need to get into the tier two or tier three supports. And ultimately, the goal of this program is to create a healthier school environment. The goal of this program is to be able to address the things that take away our students' attention. We want to get rid of those. We want to get rid of those problem behaviors or those issues on campus, so that way they can focus on their academics and they can focus on their social well-being at school. So next slide, Marwa. So to give you an idea of the way our program works is our program has various different components, and you can look at it through this multi-tiered system of support, which is tier one. As you all know, this is where we focus on prevention. And our means of prevention is really how do we embed prevention curriculum to our students that allow them to be educated by in the classroom. Also, another big part, and probably the most important part of this program, is student-led activities and events. This is where we partner with our students. We really work with our schools to create student-led clubs that allow them to be able to address this issue. And what we have found, and data actually shows, is that when students are connecting with each other, they are more likely to listen to each other. And so that's why we really rely on them to be able to do a lot of that prevention messaging. And then we also part of this program is the California Healthy Kids Survey. We'll kind of touch on that a little bit later. But the tier two part of it is we have alternatives to suspension, which we'll share some various resources, and we really focus on restorative practices. Really, the goal is we're trying to shy away from punishing our kids for using these things, and how do we help them be able to understand understand the behavior and really help coach them into better decision making. And then, of course, a tier three, which is really connecting them to cessation resources. So if you don't mind clicking on the next slide, Marwa. So really the core components and the main focus of me being here today is that a lot of you are working with that fee schedule. We're working on creating or being part of that fee schedule. And we want to talk about how each of these components could fit right into that, because we understand that all of you are in some way doing this work already. And so the idea is that by being part of this program, we can help work with you so that way we can make sure that your system gets built in a way that when you are providing these interventions or prevention opportunities, what you're doing is you are also getting reimbursed for them. And we'll kind of touch on that a little bit later. But as I mentioned, from the MTSS model, these are the main
What's that?
components. It's student education and
Webinar.
prevention, early intervention and support, cessation resources, and then really we come at it from an equity lens. So understanding that this program is designed to look at students who are more at risk of substance use and being able to work with them and address them in a unique way that we wouldn't address the general population. And then, of course, like we mentioned, the California Healthy Kids Survey. Really, I know the California Healthy Kids Survey really gives the state a way to measure the success and impact of this program. Ultimately, this program is measured by, are we seeing kids using less substances, and then are we seeing an increase in student connectedness at their school sites? So if you don't mind, Marwa, next slide, please. So I'll touch on this one real quickly, which is the student education and prevention. This is our tier one supports. This is where we really work with our schools to be able to create a robust tier one support, because we understand that if we can create a robust tier one support, that may help us reduce the amount of students that are going to be needing tier two supports. And that's where the drain in resources can come in. I know it's a lot of time, it's a lot of resources. So we really try to push on heavy prevention in that tier one. So part of this is classroom curriculum. What we promote is the Stanford Tobacco Prevention Toolkit or the Cannabis Awareness and Prevention Toolkit. These are both created by Stanford. The beauty of these curriculum is that they're free, they're easy to use, fully scripted, they're tied into health education standards, they're tied into the California Ed standards. And so the nice thing about this curriculum is that it's also updated every year. It's the only curriculum that can say that it is continuously being reviewed and modified to keep up with the current trends that are taking place. And the nice thing about this toolkit is it doesn't just focus on the negative effects associated to the use of these products, but it really goes, it addresses it addresses health, it addresses marketing, it addresses environment, it addresses mental health, and it addresses all these things and helps, and also coping. So it teaches our students on how to make better decisions and be able to positively cope with any mental health situations or stresses other than using these substances. The other thing is, as you can see in this picture, this is what we talked about, is we really work with our students. The idea of this program, and really the mantra of our program, is we cannot address a student problem without students being involved to be part of the solution. And if we can really work with our students and train them and give them the opportunity to be able to lead these prevention initiatives, we know that we can make sustainable change over time. So that's really what we do, is we really empower these students, we train these students, we provide them with all the materials, the resources to get them ready so that way they can make the difference on campus. So that way they are the spearheads in the education, not just you as the adults. So if you don't mind, Marwa, clicking on the next slide. So I think Veronica, you if you want to go ahead and give them this question.
Sure. So Addison has gave us a quick overview about the tobacco use and prevention education. So now we want to hear from you all. We want to know how your LEA or your district can utilize existing staff to address some of these substance use, tobacco use problems. So you can use the Google form, or you can take yourself off of mute and just, share some of your thoughts and staff that you would leverage to provide this service. No one wants to take themselves off of mute. Go ahead.
I can share. Sorry, I'm from Springs Charter Schools. We have some curriculum that we have some of our school counselors use to run some groups specifically, or our school social worker to help run some groups specifically for substance misuse, for both initial, more of like the education oversight, but also impact and addressing underlying root causes, which might be more mental health related. So we're doing that. And then we do have some partnerships with some community-based organizations in other locations where they also have a substance misuse curriculum that they use. So then they provided some counselors to be on campus or at our campuses, and they could also do some groups localized to each campus. So that's been really helpful. I put in my questions later. I'm having trouble finding a community-based partner for our Rancho Cucamonga site. So if anyone wants to message me privately, if they have any CBOs that they can recommend for that area, I'd appreciate it.
Thanks, Sarah, for sharing. Does anyone else want to share with the group how they are using staff members that are addressing tobacco and substance use?
Hi, Veronica. Good afternoon. This is Antonio from Colton Joint Unified. Kind of like Sarah, actually, we have we have our wellness centers, and at least at a couple of our wellness centers, we have done some groups, focused more centered on prevention and early intervention, if you want to call it that. But again, just kind of trying to get at those triggers and what's really kind of behind that substance use. So we've done some groups, and we've done them for the last couple of years. We kind of modify and kind of adapted some form of curriculum. Just kind of our attempt to try to reach out to kids that really need it. In addition to that, we are also very thoughtful about um, doing tobacco and substance use prevention, or at least messaging during wellness fairs, because we do have quite a few wellness fairs, or just different kinds of fairs or wellness events, I should call them, throughout the school year. So we'll try to do a lot of messaging then. We've also tried to do some campaigns throughout the school year, right? So on tobacco abuse, just trying to deter kids, right? So giving them some basic information or whatever resources we can get a hold of. So we like to call them campaigns, and we'll try to do that throughout the school. Different focus, right? Sometimes it's bullying prevention, and other times it's about, I think it's once or twice that we've done tobacco and substance use prevention. So it's just our way of trying to get information out to students.
Thank you. And Antonio and Sarah, if you guys don't mind sharing what staff members, I know, Sarah, you mentioned social workers. Are the social workers the only staff that are delivering or providing support to students regarding tobacco and substance use?
No, we also have some specialized school counselors that are specific to more the social, emotional, and mental health support. And so we've recently been doing some partnerships for interns. So we have some social work interns, and then, like I said, some school counselors from community partners as well.
Very similar for us as well, Veronica. We have our wellness centers are run by associate level social workers, and we also have interns, but specifically social work interns. I think there is interest at one of our wellness centers. We have a wellness center with an associate professional clinical counselor, so she would be the one outside of social work that would be running the group. But for us, it's mostly master's level associates.
Thank you. Are there any questions regarding this in the chat, Alex? Using existing staff to address tobacco and substance use prevention?
No, the only question on the Google form is the one from Sarah
Okay.
about community partners.
Okay, we'll get to that. All right. Well, thank you all who shared their experience. We'll move on to the next slide. So as the LEAs and districts start thinking about how we can leverage existing staff to provide these prevention, early intervention services that Addison is speaking to us about, these are some items that already exist in your school. We're going to tap into Marissa in a little bit so she can share her experience as a school principal and how they leverage staff to submit claims, or how staff that are addressing some of these substance use violations can be leveraged. So think about your therapist. I don't know if any of you all have alcohol and drug counselors. I know Rialto does. Any of your registered clinicians, LPCCs, community health workers, certified wellness coaches, and of course your school psychologists and school PPS credentialed counselors. Next slide. So this is just a mock-up of what reimbursement to the fee schedule would look like if a certified wellness coach was delivering an intervention with a student using the TUPE curriculum or the curriculum TUPE is presenting on. So the certified wellness coach would be using the health and well-being procedure code. They're going to provide this service 15 minutes to 8 students, and the reimbursement rate an assessment. The reimbursement rate is $66.24 for 30 minutes. So if your certified wellness coach met with 8 students in one day for 30 minutes, they would receive about $530 in reimbursement from the insurance company, whether it's private insurance or Medi-Cal. Next slide. All right, back to you, Addison. You're on mute.
Still haven't figured that out. So, so the other thing that we wanted to touch on was that part of this curriculum is also, like I mentioned earlier, is tied to the California Health Education Framework. So it meets these standards, and it also meets the standards of our California education standards as well. So if you could go to the next slide, Marwa. So another thing that this program that we help build with our school districts is part of the work that we do is we help create and help them improve their tier 2 supports around these violations. So really there are various different programs that we help your staff get trained on. The first two being Healthy Futures. So the nice thing about this program is Healthy Futures is designed as a restorative practice approach. It is not a punitive way. It is a positive coaching. There are various different ways to be able to use this curriculum. This could be designed as a one-on-one. You could use it in a group. There's also 1 hour. There's like, one session curriculum. There's curriculum for 2 sessions or 4 sessions. And then there's also some for opportunities for asynchronous work. So if you have a student that gets caught for the first time, they're a really good student. They never have these problems, but then they got caught that one time. There's an asynchronous option where you can assign the student in your office to do this and then having a conversation right after that. And you can, again, connect this to the fee schedule. And then we have other connections as well, like YVAPE. I'm not sure if any of you are aware of this program, but YVAPE is developed by UC San Diego. They also oversee Kick It California, which is our statewide cessation program. But the nice thing about YVAPE is that you would essentially enroll your school, and then from there, if your school, let's just say you're to the point where you've already met with a student 2 or 3 times, you can refer them to YVAPE, and it could be used as an alternative to suspension. The beauty of that is once you make the referral, then a YVAPE life coach gets assigned to them, and then they have 2 or 3 meetings with that student, and then the final meeting with that student is actually incorporates their parents as well. So that's the nice thing about YVAPE. And the great thing about this is that you as a school don't really have to do much work other than if YVAPE reaches out to you and says, hey, little Johnny did not answer the phone. We called him 7 times. Can you get in touch with him? Let him know that we're going to call again. And then that's how you would work together. The nice thing about YVAPE is you can schedule the calls to be done after school. So the nice thing is you make the referral, you say little Johnny's going back to class, doesn't miss class time, and then you'll know that YVAPE will be in contact with that student after school for that week, including Saturdays if needed. So these are various different supports that we try to work with our school districts in incorporating into their interventions and tier 2 supports. So really all of this is actually billable under the fee schedule, I think with the exception of YVAPE. If you were to train your staff on using Healthy Futures, that's something you can also use for the fee schedule. So if you don't mind clicking on the next slide, Marwa. And Veronica, do you mind explaining how this would work for the billing?
Yes, before I talk about this slide, I want Marissa to jump in and share some of her experience as a principal and how staff in her school could have submitted claims for the support that they were providing students when it came to tobacco use and substance use.
All right, good afternoon, everyone. I'm Marissa Smith. Before sitting in this seat, I was a sitting principal at a middle school. And so I'm going to pose this question to our site leaders that are with us this afternoon, our student services departments. We know that one of the things that we are battling at our school sites are the use of vape substances specifically on our school sites. And short of standing in the bathrooms ourselves or standing around the corner to try and prevent some of this use, we do have students that are using substances on campus. And so that does result in discipline and students coming to our offices. So what are some of the strategies that we have utilized as alternatives to suspension? Addison mentioned it as a tier 2 support that we are providing to our school sites. And so if somebody's brave enough to tell us what are some of the alternatives to suspension strategies that you are using at your school site, and then who is actually providing that service? And I am a teacher, so we can wait this out.
We're doing somewhat of the same things that we talked about for substance for the other services too. Like we have been, thoughtfully partnering with community partners and using some curriculum to help with a range of issues so that so for alternatives to suspension or discipline, we have some behavioral interventions. And so we pull them out and have some behavioral intervention curriculum that works to support them, especially around, it includes or is integrated with the restorative practices model. So then we consider it as part of an MTSS process rather than a discipline process outright, because really the issue is addressing underlying behavior. Usually it's not a one-time thing, it's a pattern. And so we track behavioral incidents, both minor and major. And then we, through, like I said, like an MTSS process, have them do some behavior interventions with a staff member that's funded out of some of our intervention grant, as well as our some of our other streams of funding. So that's what we're doing.
Anybody
Trying
else
to-
want to share? If I can have one more person share out. Dr. Rogers, I'm going to pick on you because your face, that's familiar to me. Is there anything that's happening in Fontana Unified around alternatives to suspensions, specifically when we're talking about substance abuse?
A lot of the work that we're doing is really around working with site administrators. So we've been really spending a lot of time talking about our MTSS framework as it relates to the academic side, but we've been really looking at that really behavior is really a systemic a system to other different needs that need to be met. And one of my philosophies are you cannot bloom without Maslow. And so we really have been talking a lot more about what are the underlying needs of our students and focusing on that sense of belonging. We do find that students, and when we were looking at some of our panorama data, as it was talking about students' sense of belonging, even some of the parent survey data that they've given us to give us insight on what are some of the concerns and worries. We've really done a very concerted effort of campaigns to make sure that students are aware, really making sure that students understand who they are to report to when they see something going on. We've also done a lot of especially at the secondary, we've been adding more PBIS assemblies where we are reviewing expectations around there. And then we've also done some other piloting a few areas, the alerts systems that are in the restrooms to let us know. So that has detoured some of the behaviors in the restroom, obviously. And I think a lot of it also has been just we currently now have a drug policy that we're about to roll out for our secondary, and specifically we've been looking at talking more about when a student is, because there were programs we needed to ensure that when students are found with drugs, or there's a situation that does arise, how do we help our parents feel that we're an ally? So we do offer with our mental health therapists, there's therapy that we do offer with some of our therapists. So we do have 7 that are already, before we started working with the CYBHI, that we are already funding, and we're looking at how we can expand it now with the funding that we will potentially get back once we start recuperating to increase additional services. And we also have other services in which we've worked on making sure that there's multi-tiered levels of support in our behavior, our mental health, our counseling, and even more so with our deans that we also have at for our middle school level. So we've been doing quite a bit of work, but I think a lot of it is just educating, especially since now that drugs, I don't want to say drugs, at least marijuana has become legal. We've seen a more of an increase.
Absolutely.
In that regard. So that's about it.
So I just want to address, how are you utilizing members of your school community that may be acting in the role of mentors through your PBIS process to be able to support our students? One of the things that we did was we looked at students who the year prior had C violations, and then we utilized our mentors to be part of their ongoing mentorship community throughout the upcoming school year. You can also look at your social workers that may already be part of your school system and small groups for students that have struggled with substance abuse previously as part of that alternative to suspension or prevention method. So those are just two things that we wanted to make sure that we highlighted as we talked about supports that we can offer that's already happening at our school sites and those members of our school community that are already part of the fee schedule. All right, Veronica, I'm going to turn it back over to you.
Thank you for that. So we just wanted to provide another example of how early intervention support using the information that TUPE is sharing with us today, how it can be incorporated into the fee schedule. So we've heard you don't have to be a licensed clinician if you have associate, if you have a PPS credential, school counselor, they can use this Healthy Future curriculum that Addison shared with us and do an intervention with the student, use a, stage 1 or session 1 with the student of this curriculum, submit the claim for reimbursement, and a 16 to 37 minute session. If it's a therapist or school counselor, you're almost getting $68 back. And if it's a longer session, it's almost $90 back. And remember, these funds are coming back to your LEA. And you guys can see the last part of that screen where it was, if you do this times 5, that's the revenue that a staff member can generate just in one day for meeting with 5 students. And I'm sure that they're probably having these regular meetings with students, and they're probably, if not more than 5 a day, I'm sure they're doing more than 5 a day. So we're just kind of giving you all an example of how this fee schedule and this TUPE work can be done, and using your existing staff that are already doing the work in your LEA. Next slide.
And if I could also add to that as well. So the beauty of the Healthy Futures curriculum, or the tool, is that curriculum incorporates a pre and post survey for the students. So the nice thing is you are also the people who implement or use that tool get a dashboard. So the benefit to that is that at the end of the year, you're able to see all the data and track behavior change over the course of a year or over the course of however many years you're implementing this. So in addition to the data you have in seeing how many students are being referred to these supports, you're also getting data from this toolkit that's letting you see what your students' behavior and thoughts and attitudes are around this at the beginning or prior to the intervention, and then how did that change at the end. So that's just another benefit to that. And the nice thing is that data is private to you, and it's just embedded into the curriculum. So it's not like something in addition that you have to do to that. And then also really wanted to touch on that a lot of the work, like Veronica mentioned, this is stuff that you probably are already doing. And what we're trying to do is work with our school districts to be able to connect this work to that fee schedule, so that way you can maximize and build sustainability, because that's the main goal, right? Is we want to make sure that if you're already doing the work, you might as well be getting paid for it. The final thing that this one of the other things that I should touch on that this program touches is on cessation resources. I mentioned Kick It California. This is a statewide cessation program. We are one of the few states in all of the United States that has our own state specific cessation hotline. The nice thing is this is a real person that can speak to someone. So if you are dealing with students or staff or parents that are in need of support, that want to quit, because what we have learned through all of the data that we have sifted through is that when students are using, what we know is that they don't mean to get addicted, and when they do, they always want to quit. All these kids, anyone who's at that point of addiction wants to quit. You can even ask current smokers in today's day and age as adults, they want to quit. So the nice thing about KK California is it's a free service that all you do is just say, hey, here you go. If you need support, you can call the KK California, and then they can contact a life skills coach through them to help them with their quit plan and quit journey. And so that's the nice thing about this program, that you can really hand it off and share it to anyone, and that's all it takes. So if you don't mind, next slide, Marwa. And then I mentioned at the beginning is that this program really looks through an equity lens. We understand that when we are addressing substances, we cannot address it's not a one size fits all approach. We understand that, especially when we're talking about marijuana, tobacco, and vaping, the data has shown us that there are specific populations that are disproportionately targeted for these products, such as students of color, our brown, our Hispanic, and our Black and our Asian students in their communities. They are targeted much more heavily by these industries to get them to start. Also, our LGBTQ plus kids, they are also at higher risk of developing some type of substance use disorder because of how much they are disproportionately targeted by these companies. And so, and then of course, for those of you who work with students in alternative education, we know that they've already been affected by some of these industries, and that they have been partaking in some of these behaviors, and we know that they are also at much more risk. So really the idea of our program is we work with our school districts to create programming that is able to address students in an intentional way rather than a one size fits all way. And again, our goal in this program is not to create another program, but really for us to look at what is the established framework in which you are doing work at your school sites, and then how can we embed this into what already exists, so that one, you can be able to prevent this from happening. Because again, why do we want to have our students being or focusing on these things when they should be really focusing on their academics? But then also it allows you to recover that cost of the time it takes you to address these behaviors. And then also really the idea is that this supports the whole child development by improving decision making. The whole goal of our program is we train our districts, we train our schools to go from a non-punitive way, rather than talking down to our kids, looking at it more from a route of how do we work with our kids and change behaviors and help them improve their decision making. That's the main goal, is how can we make them make better decisions, so that way this is not one of those decisions they want to make. And then, as I mentioned, we build these programs to be directly catered to what your district needs are, and we fit it into your current established MTSS framework. So if you can click on the next slide. And this is the one that we always touch on and people don't like to hear it, but the Healthy Kids Survey. The California Healthy Kids Survey is a part of this program. And the reason being, and this is one of the things, I know that we as educators, we have a lot of surveys that we do, and I know our students can get what we call survey fatigue. We totally get it. But the beauty of the California Healthy Kids Survey is that, well, it's a survey that we don't have to create. I know a lot of us use programs such as Panorama or anything else, but this survey is already developed. There are modules where you can customize your own questions. However, the California Healthy Kids Survey is what the state uses to measure the change in use around substance use. It measures student connectedness. It measures how mental health around our students. So this is a statewide measure. And if we wanted to bring it down a little bit more, in San Bernardino County, our various county departments, like the Department of Public Health, Department of Behavioral Health, any department within San Bernardino County relies heavily on the California Healthy Kids Survey. That's what they use to be able to apply for programming and grants that they can also bring in to help our kids in the community. So when we look at the California Healthy Kids Survey, I know as educators, we look at it and say, oh, well, we can't do this. It's just more work. But you can think of it in this way. One, we're looking at school climate and safety. We're looking at health behaviors, mental health well-being, and protective factors. And it allows us to get some good quality data to inform decisions on how we want to make our programming happen at the school level. But at the same time, by us doing that part at the schools, we are also supporting our community, our county, by allowing them to be able to bring in more funding using this data. Believe it or not, San Bernardino County is actually one of the lowest grant funded counties in all of California. And the reason being is because we have a severe lack incredible data that's consistent. across the board. So this is why we really push the California Healthy Kids Survey. It is a non-negotiable of the program if someone is interested in joining. However, that's something that we help the LEAs and our districts, how we help them coordinate so that way they can collect this data real easily. So go ahead and hit the next slide. So again, I know I touched on some of the benefits, but here are some things that I really want to touch on, is that you receive specific reports. You will get school specific reports, you get district level reports, and then you also have access to a dashboard where you can have access to the raw data. This helps you inform what policies you need to make, any other interventions you need to bring in, are there any additional supports that are missing? It also helps you when writing with your LCAP priorities. If you're looking for areas that you need to address using your LCAP funding, this allows you to be able to tie that into that. And then also, ultimately, it helps us identify the trends in our students' health and substance use. And then school connectedness, because what we know is one of the number one indicators to prove whether our students will be academically successful is if they have a trusted adult, at least one in their schools. And this is what this data can help us measure. It helps us look at substance use. It helps us look at behavioral health. It helps us look at that school climate and connectedness so that way we can learn how we can make our pivots as we're going along. And then, of course, you can use this for any additional grants that you might be looking for additional funding opportunities. And then also, like I mentioned, the big thing, if I'm talking about like the greater good, it helps our county be able to have reliable data that they can then bring in resources that are going to benefit our kids in the community. Because I always look at the substance use issue in our schools as, if you can imagine, a dam. Our schools are doing a great job at preventing as much of that water from breaking through that dam, which is substance use, right? However, we cannot get rid of the leak completely unless we can stop the leak on the outside. And that's why we really rely on this data to help our county be able to bring in the funds and our cities get the funds that they need to address that out in the community. So if you don't mind clicking on the next slide, Marwa. So again, benefits to this program, and I wanted to highlight that this program there is no cost to this program. This is a grant funded program where we really partner with as many districts who are interested, because what we understand is we know in a time right now where funding is getting smaller and smaller and it's getting cut. We're also seeing a drop in tobacco revenue because we're obviously doing our job. There's much less kids using. So what this requires us to do is be able to essentially pull in our schools together to maximize the amount of dollars that we can bring in, which allows us then to be able to disperse the resources in an equitable way across all of the participating school districts. And then what this also does is it provides you, the school leaders, with ready to implement resources that reduce these discipline burdens. So really our job at the county is to be able to help you incorporate these things into your system so that way you can get reimbursed, but are also seeing the fruits of your labor, which is hopefully a reduction. And what we're seeing in the data is, yes, you should be able to see a reduction in the number of violations you're seeing around this. Another thing is that we are all tobacco-free schools, but this really pushes that narrative that we are ensuring that compliance. We are showing the community, we're showing the state that we are committed to creating an environment that's free of tobacco and free of other substances, so that way our kids can focus on the things that matters, which is their academics. And then the other benefit is, the nice thing about this program is our team, we are not going to just front load you with this information. This is a 3-year program that we will work with you for the next 3 years, hand in hand, to be able to build this system and provide the appropriate technical assistance and cater it specifically to your district needs. So that's our goal, is to create our programs that are going to benefit your district. Just because I know we heard Fontana. If we were to work in just to kind of quote unquote, if we were working with Fontana, the work that we do with them would look much different than the work we would do with Colton, because the needs are different. So that's the benefit of this program. And Marwa, if you can go ahead and click on the next slide. And then also what we know is that if we can improve the school climate, if we can create an environment that is free of drugs, if we can create a climate where students don't have to be afraid to go to the bathroom or don't have to be afraid about being peer pressured into using something, we know that that can improve school climate and connectedness, which allows us to increase academic outcomes. It also reduces chronic absenteeism. So if we have students that are not being suspended for these substances, we get them to stay in class where they can be focusing on their academics. So really our goal is to improve academic outcomes, reduce chronic absenteeism by reducing suspensions and reducing absences, because if we have students who are not using substances, they're not too sick to come to school. And then the last one is that ultimately, these are linked to better performance and measurements on the California school dashboards. We all want to be in the green. We all want to be in those colors. This is going to help with that. And if you can click on the next slide, Marwa. So just wanted to mention that I am one of 5 on our team. I believe I call her the chief, or my chief Beatrice is on here, and I'll give her a minute if she would like to unmute herself and speak if she can. But she's our coordinator, and she gave me the opportunity to speak with you all today. And so just so you know that our team is here, we are a team of 5. We're small but mighty. So I know that we will be, for any of you school districts that are interested, please let us know. I'll be dropping my email in the chat box. If you're interested in knowing more, we'd be happy to connect with you, because again, our main goal is to be able to bring you resources and help you create programming that's going to help prevent this, and that we're going to help you connected to that fee schedule, so that way not only are you preventing substance use, but you're recouping costs, and then we're also seeing an improvement in our health indicators and our academics. And then the final slide, Marwa. Our resources. If you're interested in any of the resources that we have tons of webinars and workshops that we're hosting, in addition to what our team here with Veronica and Alex and Marissa and Marwa and Karen. In addition to the work that they do, we are also hosting various webinars. If not, we have a bunch of tools that you can access there by clicking on using that QR code. That's going to link you directly to our website, and you can find everything there. So before I jump off and you can finally not hear my voice, does anyone have any questions for me? And then also, Beatrice, I'm not sure if you're on, if you would like to make a few closing comments. I think I saw her on there, but I don't want to call her out in case she's a little busy.
Addison, I'm here, and you made me laugh because I'm certainly not the chief. I think that it's fair to say that everybody on the Healthy SBCSS would be considered a servant leader. And so with all the information that's been presented, an invitation to everyone on this call to please tap into our resources that are available to you today. I know Addison covered a lot of technical material and content, but at the end of the day, you don't have to be a part of the consortium to tap into the resources that are already available. We're here to answer any questions, happy to partner and align, work alongside you to address the needs of your students when you're discussing substance prevention or anything to do with peer leadership, advocacy, that kind of stuff. And so with that, yeah, thank you, Addison, for the high-level program overview. We're happy to connect with you. Don't hesitate to reach out to us. Turn it over to Veronica or
Yeah, so the next slide is just our Q&A, but if anyone has questions, you can feel free to take yourself off chat and ask your question. No questions?
I must have done an excellent job.
Veronica, this is Paul. Good afternoon. Good to see you.
Hi, Paul. Nice seeing you. Thanks for joining us.
Glad to be here. I'll ask the question. I sat through 3 presentations earlier today, and this one was very impactful. I copied the link for the live binder, and I have that on my other window. So I'm assuming I can go back through there, and that's really going to help me get started with this program, because I certainly don't want to miss out on that.
Sure, but I'll share your information with Addison and Beatrice so they can reach out to you as well, Paul.
Please do. Much appreciated.
Thank you, Paul. We'll be in touch.
Looking forward to it. Thank you much. Good to see you, Alex.
Absolutely.
Are there any other questions? No. Okay.
Veronica, just real quick. So, okay. I apologize and thank you, Paul, for being brave and stepping out there. So I was assuming that basically, so we're in the beginning stages of this and needing to figure out how to capture insurance and information, et cetera. But that doesn't mean that we can't start utilizing 2P and YVAPE, and I think it would be good to be building that before the fee schedule is in place, and because they're excellent resources. But if I understood what you just asked, Paul, is So is this something we have to sign up for, or these are just things that we can use now? I guess I missed that.
Yeah, Beatrice, did you want to answer that question? No? Okay. So yeah, so like we mentioned is, so there's two different ways. You can access the resources right now if you would like. They are available to you. Everything's free to use, so nothing is that you have to sign up for anything. Now, what we would mentioning is there's another opportunity as well. So every 3 years, there is a grant opportunity that opens up through the CDE. And what we usually do, and we have done this for the past 6 years, and we've grown our consortium. It started with, I believe it was just 6 districts. We grew to 10, and now we're opening it up again. So what the difference between you accessing the resource and then also joining the consortium is that I believe there it just opens up more hands-on direct work that we would do to support you and being able to do the work, or not do the work necessarily, but help you build that system like you mentioned to fit the fee schedule. So that's the kind of things that we can do. We would also work on the prevention aspect, being able to work with offering trainings for the students, doing workshops for them, giving them opportunity for prevention efforts, and then also really at the end of the day is really helping you as a district be able to create that system that's going to allow you to incorporate this, so that way you can maximize the amount you're able to bill for. So that's the benefit to joining the consortium, is that it would be a more hands-on tailored approach where we would work with you for the next 3 years and making sure that we can get your system to the way you want it to be. Whereas if it's just stuff that you want like some basic technical assistance, we can kind of help you, walk you through the resources, kind of give you some recommendations on how it could work. But the tier 2 program or that consortium would allow you to, again, just, it would be more, like I said, an in-depth partnership that we would do over the course of the next few years. And that would be at no cost to anybody.
So Veronica, while you're sending information out to Paul, could you include me in that list, please?
Yes, I will.
Thank
And Ben, I think Karen emailed you, so we're gonna come meet with you soon.
Uh-oh.
Okay. Are there any other questions, guys? We really want to support you as much as we can. I see you, Roy. We'll be in touch too. Fontana,
Yeah, I
Hesperia.
had a question.
Oh, you had a question. Okay.
Yes, that's what I was trying to do. Okay, so as we're still trying to work through like who and how we go about getting our PPS credentialed people in the fee schedule for reimbursement. So so two things came up. I know that my PPS credentialed school psychologists are able to bill in SPED care already, but for the CYBHI, it seems like I have to have a licensed person to oversee theirs. Why is there a difference? And you could just tell me that's what it is, and I'll just accept it and I'll move on.
So remember, it's the ORP. It's the same thing that we spoke about earlier today. It's not that they're being monitored. It's not supervision. It's just that a licensed practitioner is tied to their, I don't know, case note, I guess. I know Mario's on here. Is Antonio still here? Because they're actually doing the work, submitting claims. Maybe they can explain the ORP better. No, they're no.
And see,
no
the
longer
reason why
here.
I'm asking is because every time I've talked to someone who has a license, they all go, their response is different. And so I'm like, it must be the way that I'm saying it. So I'm trying to even get language that maybe it can be a bit clearer, because I think anyone is going to be apprehensive of having someone work under their license if they're not controlling or directing that work, you know what I mean? And so like, even when I mentioned it to the school psychologist, she was like, well, I could, but she was like, what if? And I was like, I get where you're coming from. And it's not the same as with me overseeing someone who's getting their credential. You know what I mean? And so like I can sign off on some work that they're doing at their school sites, et cetera. It's not the same unless it is, and I just need to figure out how to communicate that better.
Yes. So our meetings with the state, they've never said that this is tied to clinical supervision or oversight. What they're saying is that they're aware that this licensed educational psychologist is doing work and submitting claims to the fee schedule. That's all the ordering, rendering, providing status is. And I do know if you're using Healthy Campus as an EHR, they are providing our ORP. They're at least offering an ORP as an option for situations such as what you're describing. So I know you guys are using Practical. I'm not sure if that's going to be an option with Practical, but you can ask.
I already
No?
asked. No, so I was trying to and then they were
Okay.
trying to figure out how they were offering it, which I was like, I'm not trying to do that. So I guess then will Healthy Campus let me pay for
Their ORP?
yeah.
I'll ask. I'll ask.
Good. That'd be great.
Okay. All right. All right. Are there any other questions? Because I'm going to actually, we have 3 minutes. I just see James, see my boss on here. Go ahead, James, hype us up. We haven't seen you.
Hello, everybody. Veronica, you the good. Hello, everybody, man. Hey, Addison, thank you for the presentation. And to, like I said, Mr. Skinner, Mr. Robertson, hopefully, certainly get into it. How you doing, Ms. Adams? Make sure you get into it. Gonna help support the prevention work and as well as that reimbursement. So certainly an opportunity. We want to make sure we bring this into the group so that everyone's understanding how they can de-silo a lot of the work that's happening in our districts and our LEA. So really good work happening. Thank you guys. Thank you team, everybody for the office hours.
And Ms. Adams, I will answer your question. I'll email you or I'll give you a call.
Thank you. Thank you.
No
Yeah,
problem.
we just want to find some solutions for our capacity grant to provide some services. Yeah, and that with that campus.
Great.
Thanks.
Thank you. Okay.
Okay.
Well, thank you guys. We have 2 minutes to spare, but thank you for joining us and we will see you soon. Bye-bye.